Okay, so now I'm not working at the school anymore, and I need to know how to use the money in my healthcare savings plan. And I'm hoping you can help me figure this out.
It's not too difficult. Glad to help.
Now, this pays for my medical expenses.
Yes. Once you've retired or have left employment, it can be used for reimbursement of monthly insurance premiums and other eligible out-of-pocket medical expenses. It's important to remember that this is a reimbursement account, so you're responsible for paying your provider for the expense. Then, with proper documentation, you can submit a request to the Minnesota State Retirement System for reimbursement.
Okay, so I pay the bill first, and then my HCSP account reimburses me?
Right. Your information guide has a list of reimbursable healthcare expenses. It's a long list that includes copays, deductibles, and vision and dental expenses. It even includes monthly health insurance premiums. Also, it lists healthcare expenses that are not reimbursable.
Uh-oh, no dental floss, huh?
Guess not, and no suntan lotion either. But here is a list of additional reimbursable expenses if you have a physician's note. Now, acceptable documentation for insurance premiums must include the insurer's contact information, name of the person covered, coverage dates, and amount payable itemized by type of insurance coverage, either health, dental, or long-term care coverage. Acceptable documentation of other out-of-pocket expenses must include the provider's name and contact information, date of service, amount charged for service, the insurance reimbursement amount, if any, the person for whom service was provided, and the treatment or services provided. And this is a caution. They have examples of unacceptable forms of documentation, including canceled checks and bank or credit card statements.
I'm going to have to pay attention to this.
Soon it'll be second nature. You should find a reimbursement request form in your information guide, which you can copy and use. Or you can find them online for downloading and printing. Or you can call it MSRS to send one to you in the mail. Either mail or fax in the form and documentation, and you'll get a check back in the mail. Or you can set up easy direct payment into your bank account. Very handy for reimbursing monthly insurance premiums. Well, that's it.
That's it. Thank you.
Yes, you're welcome. Medical costs can really take a bite out of your retirement savings. That's why it's great to have the tax-free healthcare savings plan to reimburse eligible out-of-pocket medical expenses.